Everyone for joining. This is the University of California, San Francisco Global Child Health Lecture Series, and it's our pleasure today to have Dr. Lisa Patel. On a personal note, this is honestly one of my favorite talks of the entire lecture series. It really combines what we're hearing in the news and seeing with the health impacts, which is just, it's alarming and also inspiring at the same time. So Dr. Patel is an executive director for the Medical Society Consortium on Climate and Health, and also a clinical associate professor of pediatrics at Stanford Children's Health. She trained as a pediatrician at UCSF and completed the global health pathway. So for those of you who are in her shoes, this is what you have to look forward to. And then she's also on the executive committee for the Council on Environmental Health and Climate Change for the American Academy of Pediatrics. And we're really honored and so pleased to have you here, Dr. Patel. Thanks. And I can monitor the chat for you and as well as questions. And if anyone has a question, if you wouldn't mind just saying your name and where you're from, it always helps us as well to understand kind of who's on the call. Thanks so much.
Great. Thank you so much for having me. And as Teresa mentioned, I was a resident now 12 years ago. And so it's really fun for me to be able to come back and do this lecture every year. So the objectives of this talk, we will talk about ways that climate change and activities of the fossil fuel industry negatively impact human health locally and globally, describe why climate change worsens health inequities, and talk about ways to integrate climate change into our counseling, into our advocacy efforts on an individual, community, and policy level. Oh, and sorry, just in terms of time check, 1 hour for the lecture or 45 minutes and 15 minutes for questions?
Yeah, we have about an hour for the talk and then 15 minutes for questions.
Okay, perfect. So no financial conflicts of interest to disclose. And what I want to start with, and I think this summer has been a big awakening moment for many of us. I'm probably going to start changing this presentation moving forward because I don't think I need to say this anymore. I think when I've been studying climate change now for 25 years, I studied it when I was in college and I was an environmental scientist before I became a pediatrician. So when I started studying it a quarter of a century ago, it felt like it was something in a distant time for a distant species in a distant place. But we understand now that climate change is here and it is now and it is us. So it is occurring in places all around the world. About 85% of the global population, even a year or two ago, had been affected by climate change in some way, shape, or form. I would posit after this past summer, that number will go up even farther. It is now we are experiencing the effects of climate change in this moment, as opposed to it being something in the distant future. And it is us. I think many of us, when we think about climate change, the first image that comes to our mind is a polar bear. And a lot of the work I do at the consortium is to switch our frames and understand that climate change actually, and my colleague Alex Rabin and I had a chance to make this argument in the New York Times that climate change will be the greatest determinant of health for a child born today. And so I like this graphic from the Lancet Countdown. Every child born today will be affected by climate change, and how we respond will determine the world we live in. And so are we creating a world where children can merely survive, or are we trying to create a world where children can thrive? Recognizing this, in 2021, 200 major medical journals, including the New England Journal of Medicine, BMJ, and the Lancet, published the same editorial on the same day, calling climate change the greatest threat to public health in the 21st century. And since then, we've actually seen more and more from, whether it's from the American Association of Medical Colleges, the American Medical Association, these very big, large medical associations doing more work and passing more policy in the realm of climate change. We'll get back to this at the end of the presentation. I just want to plant this bit of data in your minds about how many Americans are concerned about our climate change compared to our perception of how many others are concerned. So the consortium is embedded at the George Mason Center for Climate Communication. It was started by a researcher, Dr. Ed Maibach, who was doing a lot of research to understand what Americans' perceptions were of climate change. And what he's found over time is this chunk of very concerned and somewhat concerned have been growing throughout the years as the impacts of climate change become very clear. You can see that even in 2021, about 3/4 of the country was either very concerned or somewhat concerned. But then you look over here in terms of our perceptions of how many others are concerned by this, and you can see that there's a large gap. And the reason for this is that we don't talk about climate change nearly enough. This isn't something that's visible to us as much as it should be in terms of our civic discourse. And so we'll talk about ways to address that. Just a very brief primer on climate change to talk about why this moment in time in particular is so important. So 10,000 years ago, our last ice age ended, and with that, there was more carbon dioxide in the atmosphere. Now, some amount of carbon dioxide has actually been good. It helped warm the planet. It made things like agriculture possible. It stabilized our climate. And so we take for granted that more or less, there are obviously some anomalies in our weather patterns, but more or less, we settled into a fall, spring, winter, summer that allowed things like agriculture to boom at roughly the same time all around the world, because you knew where the warm spots were, when it was going to be warm, and where there was enough water to grow things. And so we settled into this period of pretty remarkable stability that allowed the human population to boom pretty dramatically. Well, as our population boomed, we needed to find ways to power it. So fossil fuels were identified early as something that we could burn to generate our electricity or generate the power that we needed for factories. But you can see that even so far back as 1912, somebody predicted that this was going to be a problem. When we burn fossil fuels, we release two things at once. We release this black, horrible, sooty nastiness that we're breathing in, which is called particulate matter pollution. We also release carbon dioxide. And so in this article, this person does this calculation to say, if we're burning this much and pumping this much carbon dioxide into the atmosphere, this is going to present a problem. And sure enough, it does. So again, if we look back into the record a million years back, you can see there have been fluctuations in our carbon dioxide, but you can see here how quickly the carbon dioxide has shot up since what we call the Anthropocene, which is the era of humans and how we're affecting our climate. And so this is what is concerning. What is concerning is both the level of carbon dioxide we're at now, but how rapidly that level of carbon dioxide has risen. And what it's done is it's taken this period of remarkable stability and destabilized it. And that's why now, for example, you can have heat waves in Canada, a polar vortex in Texas, a hurricane in Southern California, wildfire smoke in New York City. No, we can't predict anymore where these threats are going to present or how they're going to present. Weather patterns are completely upended, and we're in what Dr. Katherine Hayhoe calls now a period of global weirding, where we can just expect the unexpected. When we look across what the causes are for the greenhouse gases that we're pumping into the atmosphere, and again, I want to emphasize that carbon dioxide in and of itself is not bad, right? It's a little bit like a warm blanket that's allowed civilization to thrive, but now we've pumped so much in, it's more like a smothering blanket because there's so much up there. But in addition to carbon dioxide, methane is another very potent warming gas that we release. You can see our energy consumption, so things like energy use in our buildings, our transportation sector and industry are the biggest chunk of our greenhouse gases. And then agriculture also makes up a pretty big chunk of it as well. I only have an hour, so I can't get into all of the various ways we are seeing climate change play out in different places. I just want to give a brief snapshot. Severe drought plus poverty put 1 million people on the brink of famine in Madagascar. Then the drought event is likely driven by climate change. Worsening monsoons who are driving floods and mudslides in parts of India. There were historic monsoon season last year where 1/3 of Pakistan was underwater. Bangladesh is under the level of the sea, and so we can expect vast parts of Bangladesh to be flooded with sea levels rising over time. Many island nations will disappear in our lifetimes, and certainly in my children's lifetime. And then there were historic heat waves both in the US and in Europe and parts of China as well. I was actually in Greece during the heat wave when they had to shut the Acropolis down because 12 elderly Germans collapsed in the extreme heat, and they just ended up having to shift all the hours or close the Acropolis on days of very bad heat. As a result, today's IPCC, so IPCC is the Intergovernmental Panel on Climate Change, reports a code red for humanity. We put out these reports, and you know, those of us practicing in hospitals, we talk about alarm fatigue, right? Like that alarm keeps going off, and at some point you just stop listening. And whenever I read these reports, sometimes I feel like that's what's happening to us. They seem to come up with stronger and stronger and stronger language to try to get people to pay attention. And at times I worry that we are in our own alarm fatigue about taking this crisis as seriously as we should. And how do we address that? Just to give people a sense of what the stakes are, you know, we hear these numbers, what does 1.5 warming mean? What does 2 degrees of warming mean? So people have a sense for this. We reached 1.5 degrees of warming this year. Now, to count it as sustained warming, we have to follow it over a few years, and this is probably not going to be sustained 1.5 degrees of warming. But this is to give you a flavor of what this world is going to look like at 1.5 degrees. 1.5 is the level that we are within the Paris Climate Accords we do not want to exceed, because past that, we feel like we can adapt at 1.5, but past 1.5 degrees of warming, it feels like the effects can become runaway, and it will become harder and harder to adapt, and the suffering will be much, much greater. But at 1.5, what we can expect is ice-free summers in the Arctic, a 100% increase in flood risk, 1 billion people exposed to severe heat waves every 5 years, 350 million urban residents exposed to severe drought by 2100, for example. Huge loss of our coral reefs. We're beginning to see that in places like Florida. And then lots of loss of biodiversity as well. At 2 degrees of warming, you can see 2.7 billion, so triple the population is exposed to these heat waves every 5 years. 100 million more people exposed to extreme drought, even worse risk of flooding, you can see, and pretty much loss of our coral reefs all around the world. So let's shift a little bit to hope. I'll give you some doom and gloom, but a few things to be hopeful for, and just a little bit of conversation about my own trajectory. I worked in global health. I worked for the Environmental Protection Agency, and I worked in India before working on clean water and clean air projects before I went to medical school. And I thought I would go back to doing more international work when I finished residency. And then an event happened in 2016. I think in my mind, I thought, there's no way, you know, with all the evidence that's there, there's no way humanity is going to drive itself off a cliff. We will do something about climate change because we have to. And then in 2017, the administration that came to power withdrew from the Paris Climate Accord. And I realized, I was like, oh no, we are willing to drive off a cliff. And I just changed everything that I was doing. I shifted all of my work domestically because I understood that if the US failed to be a leader on climate change, this had global implications. And so I went all in on doing advocacy domestically for the US to really be a leader globally on this issue. And morally, we should be, because people will say right now, well, China's emitting more, India's emitting more. That might be true, and the US has made gains, but historically, we have been the largest contributor to greenhouse gas emissions to date. And we should be responsible for that. We should be held responsible to that. In 2020, we had a new administration come to power that renewed our commitment to the Paris Climate Accords. Also, that should give us a lot of heart and hope. We've signed the largest piece of climate and health legislation. It was the Inflation Reduction Act in 2022. We have a suite of regulations being considered by the Environmental Protection Agency to help the rest of the way towards our commitments. All of these things should give us hope, but there are also forces that are seeking to undo all of that. So we can't let our guards down. And then the other piece about this, you know, I've talked about a lot about the doom and gloom. And so on the left is the world that we live in. It is unsightly, polluted, isolating, harmful, and inequitable. The solutions we're talking about in terms of climate change, these are things that can help us create a world that is beautiful, clean, connected, healthy, and just. And so, yes, we frame climate change as a problem, but it is also our opportunity to learn from what we've done and create a world and the vision of how we think it should be. And we have the opportunity to do that. Okay, with that, we're going to talk about climate change and health. Were there any questions in the chat? Oh, okay.
No questions.
All right.
I put a link to the article you wrote in New York Times.
Oh, great. So like I said, to do an entire course on climate change and health would take a very long time. And actually, there are boot camps that do this. The Global Consortium on Climate and Health Education does offer a boot camp for health professionals to go through a lot of what's on this graphic here, if y'all are interested. I think they're offering the next one in 2024, early in the winter. But I'm going to focus on the first two here. So we're going to talk about air pollution and wildfires and extreme heat in depth. But just to mention that we are seeing more episodes of severe weather. A perfect example of that was the tropical storm that came through Southern California recently. Environmental degradation and degraded living conditions and social inequities. For folks that are following what's happening in places like Louisiana and Mississippi, they are getting hit with one hurricane after another hurricane. There's a city called Lake Charles where hurricane, chemical plant explosion, hurricane. And these are places where a community barely has a chance to recover before the next disaster comes through. Jackson, Mississippi, a city that has a higher percent minoritized population, where there has been historic disinvestment in their water and sewage system. That sewage system basically broke because of flooding events. And now you have a large city in the United States of America without potable drinking water. And unsurprisingly, they have a high percentage Black population in that city. Changes in vector ecology. So this too could be its own whole lecture and topic. We are seeing for the first time, and we don't know yet whether this is climate change driven or not, but there have been reports of endemic spread in places like Florida and Texas. So not travelers that came in with it, but spread between people in places like Texas and Florida. And the models have long shown this, that we're going to see a spread in terms of where the mosquito habitats are and where these diseases are going to be as well. Water and food supply impacts and water quality impacts. So with these flooding events, it can overwhelm our water drinking facilities and cause a spread of different waterborne illnesses that people can get diarrhea from. So let's first talk about heat in particular. We had and I'm just curious if people just want to come off mute. If folks were in parts of the US or other parts of the world this year where you experienced the extreme heat, I'm just curious what experiences people had this past summer, or if you had any. For most folks around here, we've been spared. It's been a little eerie. I've been doing a lot of news interviews for what's been happening in other parts of the country, because I have my own eco anxiety and eco dread, living here for 11 years. And when the summers start is when my dread starts, because I have kids that are 8 and 5. And so my 5-year-old, 4 years of his life, we've had to live through terrible wildfire seasons over the summer. And it's been very strange that we've been here, and so far our wildfire season hasn't been too bad, and we haven't experienced too bad of extreme heat here, while the rest of the country has been going through episodes like this. So Phoenix, Arizona, I think is a good example. This was the 2021 heat dome that settled over Oregon and Washington. And this was reporting that came out of the Washington Post that I think did a really good job of talking about what this looks like on the ground. And so they wrote, physicians raced to provide fluids to patients who arrived breathless, dizzy, and drenched in sweat. Others were brought in on stretchers, their body temperature so high, their central nervous systems had shut down. Those who could still speak told of stifling apartments and sun that made their skin sizzle. Some had tried to walk to county cooling shelters only to collapse in the blistering heat. They've done studies on what the human body can handle physiologically in terms of heat, right? Because there's a point at which our very proteins will denature because it is too hot outside. So an adult without any medical conditions, at rest, drinking water continuously in light clothing, can handle 115 degrees with minimal humidity. And we exceeded that threshold in many parts of the world. I worked 2 shifts last summer. We had a heat dome over Labor Day weekend when temperatures topped 116 degrees at my hospital. And it was 2 of the worst shifts I've had to date. I'm a pediatric hospitalist, pharmacist, so I go to deliveries where the mother might be in trouble in terms of labor. I care for children that come in for any complaint, and so tons of kids came in with respiratory complaints. Tons of labors I had to go to. There was a lot of meconium, mothers with temperatures, where I actually wonder they were in southern facing rooms. So I think they just got very hot in those rooms because our air conditioning systems couldn't keep up with how hot those rooms got from being southern facing. So this was an issue all around the world. This picture here on the bottom is Phoenix, Arizona. People, I saw news reports of people falling on the pavement in Phoenix and sustaining third-degree burns from how hot that pavement had gotten from those days of sustained high temperatures. As I mentioned, the Acropolis shut down while I was there. Mexico as well was baking under killer heat wave. Roads warped in India. The projections are, and most people don't know this, that heat is actually the #1 weather-related killer, not tornadoes or hurricanes or floods. It is actually heat. And there was a study by Tama and Jinnah in 2020 that projected that if climate change goes unmitigated, that deaths from heat globally could be on par with deaths from all infectious diseases combined by the end of the century. Why is this, and where does this happen? So if we had, protective means, so if you can stay in an air-conditioned apartment or can find a bit of shade, or you're not living in an urban environment that tends to heat up from the concrete, there's a possibility to stay safer. But the reality is that vast portions of our globe lives in high levels of poverty where they may not have access to those resources. And so then the analysis is that people on average heat wave exposure in the poorest quarter of the world during the 2010s was 40% greater than the wealthiest quarter. And we can expect this to get worse. The people who are likely to suffer the greatest ill effects of climate change are also those that were the least likely to contribute to it. When we think about heat in terms of how we protect one another or who is more likely to be vulnerable, we think about 3 aspects of vulnerability: exposure, sensitivity, and adaptive capacity. And so thinking about vulnerability this way helps us think about who we should be counseling or what resources we should be putting into place to help people stay safe. So exposure is a person more likely to be exposed to the threat of heat, for example. So people experiencing housing insecurity are more likely to be exposed to extreme heat. We've seen terrible examples of outdoor workers who are not getting the protections they need. Athletes are a very, very important population because when the temperature just goes even a couple of degrees, athletes that are physiologically conditioned to handle a certain heat can get tipped very quickly into trouble. And then incarcerated individuals, there are actually some news stories around prisons that didn't have air conditioning, where a lot of prisoners were suffering from the ill effects of extreme heat because they couldn't keep themselves safe. They had to rely upon the wardens to do that for them. Sensitivity, so physiologically, there are certain populations that are more sensitive, those who are elderly, infants and young children, pregnant individuals, those who are bedridden, mental illness, chronic medical conditions, and those that need life-saving equipment or medications as well. And then your adaptive capacity. So these are populations that may be unable to adapt. So people who need mobility devices, socially isolated, those that don't speak the prevailing language, that don't have access to air conditioning, and those that are unaccustomed to living in extreme heat. An example of how all of this plays out. So I've discussed that there are the populations that are vulnerable by physiology, and then the populations that are made vulnerable by things like racism and poverty. In 1995, there was a heat wave in Chicago when a disproportionate number of Black Americans died. And the city went back and did some community surveys to try to understand what were the factors that contributed to this. Well, many residents in these communities reported not feeling safe opening their windows because they lived in over-policed neighborhoods. So they were more willing to bake inside than deal with the risk of opening their windows in their neighborhoods. As we think about other vulnerabilities, and particularly as it pertains to the Bay Area, we need to think about air conditioning. So there are parts of the world of the US that are adapted to extreme heat and parts of it that are not. I grew up in Houston, and so we would go from our air-conditioned house to our air-conditioned car to our air-conditioned school. And so we can more or less stay safe from the heat. And you can see that there are high levels of air conditioning coverage in these traditionally hotter and more humid cities. And then you look down at the bottom and you can see that places like Seattle, San Francisco have much lower rates of air conditioning coverage because we just haven't needed it. So when these extreme heat days come, it is particularly dangerous in our area because people may not have the protective mechanisms when they're home. And I would say until recently, we were not putting enough resources into people being safe in public spaces. So 2020, we had both a terrible wildfire season and a heat wave on top of the pandemic. That meant public places of cooling were closed. And the counties kind of scrambled to put together whatever they could. But what happened is in San Francisco, for example, they opened a cooling shelter in the Bayview. It was a gymnasium. They put out some folding chairs and then they positioned a guard outside. And so people didn't feel safe going in, but it also didn't honor the fact that we can't ask people to just stop their day and sit inside of a gymnasium. So there's a lot of work going on right now about mapping the sites where a community member can move from place to place, getting services that it might need during the day. So a community center, a library, a grocery store, and making sure each of those places are points of cooling so that people can move through the day, getting resources or connecting with community members, and also have the opportunity to stay cool. I've done a lot of work in the space of schools and their preparedness, and there has been a lot of attention this year. This article is actually from last year, but if you look in the news right now, there's a ton around wildfire smoke in schools, particularly on the East Coast, extreme heat in schools that don't have air conditioning. This was very personal for me because my two children are in the San Francisco Unified School District, where most of our buildings don't have air conditioning or filter what are called HVAC systems. These are centralized systems where you can do cooling and filtration. And so during the pandemic, San Francisco Unified just bought a bunch of portable air filters because that's what they felt like they could do in the moment, and that was going to be their forever plan. We actually have written a report trying to make the state come up with a better plan to get our entire building stock for K through 12 better prepared for climate change. And HVAC systems is one of them because it can both cool the internal classroom and help keep that air clean from things like wildfire smoke moving forward. As we think about other factors for who's more likely to experience extreme heat, the other thing we need to think about is redlining. So the data isn't, the data is different in different cities because different cities have played out historically in different ways about what the impact of redlining has been on things like urban tree canopy cover. But there are places like Oakland, for example, and Sacramento, where the data does seem to hold that in places that have been traditionally redlined, there is less urban tree canopy cover and you see higher amounts of warming in those areas. Now, what happens in these areas is things like concrete, black asphalt, they take in that heat and they really hold on to it and then they emit that heat back. And so that difference in heat can be up to 7 degrees higher than those outlying areas. So not only are the areas that have experienced historic redlining, they tend to be poorer, are less likely to have air conditioning or be able to afford running that air conditioner. And then on top of it, their physical environment is actually hotter because of systemic divestment from those areas. And then finally, just thinking about this on an individual patient level in terms of who is the most vulnerable, as I mentioned, those pregnant individuals are more likely to be vulnerable to the effects of extreme heat. These include risks like preterm birth or low birth weight infants, those experiencing poverty, those who are displaced or experiencing housing insecurity are more likely to be negatively affected. Infants, particularly in the first week of life, are at high risk of mortality in the first week. I've cared for a number of infants now. Either they come in hyponatremic, so the parents thought that their infant should be getting water because they were in the middle of a heat wave, or hypernatremic, they hadn't been giving their infant enough breast milk or formula and perhaps overbundled their infant. And then outdoor workers may not have protections in place or places to cool down. Texas just passed this law where they actually took away water breaks for their outdoor workers, which is insanity. There was a case of a Oregon farm worker who collapsed outside in extreme heat and died. And it took an event that extreme for Oregon to start considering labor protections for outdoor workers. I cared for a 16-year-old who came here unaccompanied from Mexico, took a job hauling brick in 108-degree weather, and came in with rhabdomyolysis and a tripled creatinine. Now, he was 16, so we were able to reverse that pretty fast with some aggressive hydration. But we know actually that outdoor workers in particular will take hit after hit after hit, and it can cause chronic kidney damage down the line. Any questions on heat before I move on to wildfires?
No questions in the chat.
Okay. Wildfires. So, like I said, we have been spared. I'm curious if folks have been in other parts of the country, either this year or historically, or if you have any experience with wildfires. I see a nod. Do you want to just share your experience?
Yeah, I'm happy to. I think, as you were alluding to earlier, the smoke in the Bay Area over the past few years, fortunately not this year. And then I was in New York right at the start of when they were experiencing some of their orange days. I'm like, oh, didn't realize that could happen over here too.
Yeah. Yeah, so these pictures are from the 2018 Paradise wildfires, and this was one of the first and worst wildfire seasons that we'd had, and it was actually I think it was one of my wake up moments about how bad the crisis was and how bad it could get. So on the left here, that's the San Francisco skyline at the top on a clear day. On the bottom, that same skyline when the air pollution actually rivaled places like New Delhi, where the same air protections are not in place. The middle are these images of just extreme destruction that we've become, I think, somewhat numb to at this point. In addition to this picture at the bottom, this felt remarkable in 2018 that you could actually see the smoke plumes from the sky. The wildfires were so enormous, but this too, I feel like, has become more commonplace, unfortunately. The frequency, intensity, and duration of wildfires are growing worse with each year. And once a seasonal occasional occurrence, wildfires are becoming yearly and year-round because of climate change. And these are just some pictures from prior years, although Greece has seen some terrible wildfires this year as well. So these are record heat waves across places in Europe, and this year in Canada as well. And then I think this was 2 years ago now, where the permafrost was actually ablaze. This is a place that's supposed to be frozen and cold, with hundreds of wildfires in the world's coldest region. Again, this is a scenario if carbon emissions go unabated. So I want to inject some hope here to say that we will not experience the worst of this, because we've passed legislation and are working on rules to prevent the worst of these outcomes. But in the worst of outcomes, we can expect a 74% increase in the frequency of wildfires by the end of the century. And there's some prediction that wildfire smoke could be the most predominant source of air pollution we're breathing by the end of the century. So wildfires and human health, it drives me bananas, and that we do not learn about particulate matter pollution in medical school, or maybe this has changed, but I certainly didn't learn about it when it drives about 8 million premature deaths per year. And what particulate matter is when we burn anything. So whether it's that we're burning fossil fuels like coal and gas, or when we are, an entire house goes up in flames during a wildfire. It produces these tiny little particles that combine with droplets, and it's basically the fraction of a width of a human hair. We breathe that in, it enters our lungs, our vasculature, and essentially sets off inflammation. Now, we have great evidence. If you look at this graphic here on the bottom, this is research from fossil fuel pollution that we are always breathing. And we know that exposure to fossil fuel pollution, chronic fossil fuel pollution over your lifetime, places you at higher risk for shorter life, stroke, heart disease, asthma, lung cancer, reduced lung function, and low birth weight. What is very concerning is that wildfire smoke, we think, is several times more toxic than that regular air pollution we breathe. So in this study, they took an air quality index of 50 if it was fossil fuel pollution, and then they took an air quality index of 50 if it was wildfire smoke. So same level of pollution. what they found was 10 times as many children showed up with respiratory distress when it was wildfire smoke, indicating that the nature of those particles must be different to be agitating the lungs more. And that shouldn't surprise us, right? When a house goes up in flames, paint thinners, chemicals, all of these things end up in the air and that we're breathing in. I like this graphic that was put out by the state of Oregon during their wildfire season, because I think it sums up nicely which populations need to exhibit greater caution. The one important one they left out is pregnant individuals. But wildfire smoke hurts children, older adults, and Oregonians with asthma or heart disease. And how does this show up? So for me as a hospitalist, I see more children with asthma exacerbations, more lower respiratory infections like pneumonia and bronchitis. And then it does also affect birth outcomes. And so there's good evidence for prematurity and low birth weight, emerging evidence for the risk of stillbirth as well from wildfire smoke exposure. As I mentioned, I've talked about wildfire smoke, but I don't want to miss a chance to talk about fossil fuel pollution that we're always breathing. And I want to talk a little bit about the way this data is presented in the slide. We put up these statistics, like a Black child is 4 times as likely to die from asthma as a white child, or a Hispanic child is twice as likely to die from a non-Hispanic white. But what drives me crazy about these types of slides is that it does not get to the why. We shouldn't just be throwing up disparities without interrogating the structural reasons behind it. And so why is a Black child 4 times as likely to die from asthma compared to a white child? Well, you take first the fact that a person of color, and particularly someone who is Black, being Black is an independent predictor for that individual being exposed to particulate matter pollution because of where we historically placed our polluting facilities. So where we place our polluting facilities is not accidental. Our freeways, our roads, our oil refineries, and our sites of oil production are more likely to be close to communities of color and communities living in poverty. We also know that pollution, that particulate matter pollution, the placenta is no barrier to it. It actually crosses the placenta, and they've found that particulate matter pollution in the fetus, in the heart, brain, and lungs of a developing fetus. So before a baby has even taken its first breath, it is already contaminated with that particulate matter pollution. Then that child is born and they're breathing that polluted air from the beginning, which also places them at higher risk for developing asthma. A Black family, for example, is less likely to be able to afford their prescription medications for asthma. And then when they show up in a clinic or a hospital setting, they receive differential care. And that results in these completely unjust outcomes of a Black child being 4 times as likely to die from asthma compared to a white child. As I mentioned, we don't talk nearly enough. We say climate change, we say global warming, but we also always have to call out the upstream agent here, which is fossil fuel pollution. The burning of fossil fuels dirties our air and drives climate change as well, and is responsible, we think, for about 1 in 5 deaths worldwide. The final piece of this in terms of health that I just want to discuss in terms of wildfires is mental health. So again, I'm a pediatrician, so I'm always thinking about, how do we create worlds for people to thrive from the moment that they're born? And we know that children need safe, stable, and nurturing environments to thrive. And disasters, particularly recurrent ones, expose children repeatedly to these types of very traumatic events. Climate change, the argument we lay out in the New York Times piece is that climate change is the greatest determinant of health because it is a threat in and of itself, but it is also a health threat multiplier. Poverty, food insecurity, housing insecurity, the existing mental health crisis that we're experiencing, climate change stands to make all of these things worse. And so as we think about creating a world where children can be safe and stable, we have to address climate change because of how disruptive climate change is across the whole range of various social determinants of health or social drivers of health. How many folks are familiar with Mona Hanna-Tisha, her work in Flint, Michigan? So she's a pediatrician, and folks familiar with Flint, Michigan, with what happened there? So she was the pediatrician who helped unearth this. She was starting to notice more and more kids, and she was just a regular general pediatrician before all of this, but she was starting to notice more and more kids in her practice were showing up with these really high lead levels, and she didn't have a great explanation for it. And it took some digging to realize that the city had switched its water supply and the lead was in the water. And she's become kind of a hero for us in pediatrics for, just a day-to-day practicing pediatrician and being able to use your skills and your advocacy to do more for your community. So she wrote this great article about, this is more about environmental justice and environmental pollution, but I think it applies to climate change broadly as well. And she wrote, the will to survive and endure can be the deciding factor between a child who overcomes adversity and thrives and a child who never makes it to adulthood. But how long can we ask people born in the wrong zip code to rise above and persevere beyond their control, no matter how central the idea of overcoming is to our archetypal American identity? So the question shouldn't be to me, how resilient can our kids be? It should be, why do we continue to be reliant on fossil fuels when we have the tools to get off of it? So climate change is both our greatest health threat and our greatest health opportunity. And then this cartoon is like, what if it's a big hoax and we create a better world for nothing? So I just, again, want to ground us in what it is we're fighting for, which is, livable cities, clean water and air, and healthier children. Okay, so what can we as health professionals do? So a lot of my work at the Medical Society Consortium on Climate and Health is advocacy and policy. Climate change is a systems, a structure problem. And so where we really need to make that change is on a policy level. We'll talk about each of these levels rising up there because and part of why I don't talk too much about the individual level is because the fossil fuel industry has been really great at making us think that somehow climate change is our problem. We did this. And so we can fix it by recycling, for example. All of that is kind of nonsense that they've created to take away attention from where the real solution needs to be, which is to transition off of fossil fuels. But we'll talk more about that. But first, and I hope you've seen this before. If you haven't, I hope you see it 20 more times in your future, which is that your voice is trusted. I'm very passionate about climate change, but I also recognize that this may not be everybody's passion, but what I encourage you, whatever issue drives you, we will not solve this crisis without everybody attaching somewhat of a climate lens to what they do. So whatever issue you are passionate about, whether it is gun violence, immigration, food security, I promise you climate change touches on it. And I encourage you to think about what those links are and build it into your work. But in addition to that, health professionals are highly, highly trusted messengers. You can see nurses, medical doctors, and pharmacists are at the top in terms of trusted messengers. So when we talk about climate change, we can help depoliticize the issue and put it back in the realm of science so that we can have reasonable discourse over the solutions for this crisis that we're facing. Okay, so let's start with what our actions can be. On an individual level, what can we do? So what you can do as a practitioner is you can know how to refer your patients to places like cooling centers, and then also be counseling your vulnerable populations. So if you're working with, I work in a newborn nursery, so it has become a standard part of my counseling with all my newborn families about how to keep their children safe during a heat wave, for example. If you work with somebody, if you're working with a geriatric population, just make sure you're building in that counseling in terms of what medications they are, hydration plans, and places to stay cool if they need to. And I should say every city now, this has been an evolution because 3 years ago, it was impossible to find your closest cooling center. The counties have done a lot of work on this and the resources are getting better year by year. I think when I last looked, Alameda County, Santa Clara, and San Mateo have some of the best. When I last looked at San Francisco, I still think we have some work to do, but I haven't actually checked this year to see where we are with our resources. Wildfires. So some counseling you can do is, people will often ask, well, what do I do to stay safe during wildfires? You counsel your patients to choose a room to spend the majority of their time in if it's a really foul day where they need to stay inside the entire day. And make sure that that is their clean room. So that's the place where they can be running an air purifier, be closing the windows. If you are working with families that have an HVAC system, you want to counsel them on using a MERV 13 filter or higher. The higher the grading of the filter, the more the smaller the particles they can draw out. And so MERV 13 is a good one that can draw out the particles without expending too much energy in the process, basically. Fortunately, portable air cleaners have become cheaper with time, so they've become much more affordable than they have been. But I work with families that are on WIC and SNAP, and sometimes this is even out of reach for them. So I know how to counsel them on how to do a DIY. There's actually one available through the Environmental Protection Agency as well. $20, a box fan, a HEPA filter, and some duct tape or nails if you want. Stick them together, and you can get about a 50% reduction indoors on PM 2.5 pollution, and then avoid activities that can worsen indoor air quality, like using a gas stove or vacuuming. Oh my God, I never want to talk about masks again. I'm tired of talking about masks, but N95s, they work for the pandemic, they work for wildfires. The best thing for wildfires, though, is to not go outside. If you do need to go outside, though, an N95 is your best protection. Second best, I will see people say that surgical masks offer no protection. And similar to the pandemic, right, where people are like, surgical masks do nothing. That's not right. It's that they offer less protection. And I'm a believer in sort of harm reduction and getting the person to do the thing that provides at least some benefit. So they don't want to wear the uncomfortable N95. A surgical mask can offer some degree of protection. And just say, right, like, I know the surgical mask is more comfortable. It's not as good as the N95, but give your patient some choice. Something is better than nothing. Although in this case with cloth masks or a bandana, nothing is better than a cloth mask. So tell them that there's no point in wearing a bandana or a cloth mask. Sometimes actually the pollution can get trapped under there and make it worse. So either stay inside, N95, surgical mask. Another thing you can do is to talk to and counsel your patients about climate change, particularly in sort of annual physicals where we're doing, you know, in pediatrics, we do this very regularly because we see kids very regularly. In the adult world, if you're doing a yearly visit, for example, there's an opportunity to build in a bit of climate counseling as it makes sense for that patient and what their issues might be. For us in pediatrics, we are constantly talking to our patients about nutrition and physical activity and housing security. And I love this article by Philip Sporn et al. That talks about, we don't need to add questions. We just provide a climate lens to the questions that we already ask. Then there's an opportunity to set an example and tell others about it. So people often ask me, well, like, what can I do? Is eating less meat or biking? And I say, okay, that's all great. But even more important to me than taking those actions is tell others that you're doing it. So back to that graph that I showed y'all about how many of us are concerned and our perception that others are not concerned. I think a part of this is that climate change feels like this big, overwhelming problem that it's almost like, well, if I don't talk about it, maybe it won't exist, right? And we know that that's not the solution. So talk about it, but also talk about it in the frame of what you are doing to address it, because it's powerful. You are seen as a model in your community. And so if you talk about how you're biking more or you're eating less meat, for example, food waste is another really important one. So food waste, we waste about a third of the food that we produce in this country, and it produces methane gas, which is very potent. And so just being very conscious, taking containers with you to the restaurant to take that food home, for example. These are small things that show that you care and start a conversation with others about why you're doing it. So we talked about the individual. Now let's talk about the organizational level. Y'all are UC. The UC system has been a leader on this. So this may not necessarily apply to you, but this is a conversation you can have with other colleagues or other residents or students that you might know that are other institutions. Health and Human Services launched a pledge for healthcare systems to sign up to decarbonize. We are about 15% of our hospital systems around the country have signed up. So we have a ways to go in terms of the number of centers. So wherever you end up going after you finish here, find out if your health system has signed the pledge and be a force to get them to sign. The way it's worked in other places is that you find other people at your center that are interested and passionate about this issue and do a sign-on letter. Write to your CEO and say, we as the students, doctors, faculty, staff at this institution want to see our institution be a leader in this issue. And we've gotten lots of centers to sign on that way. On a policy level, if people ask me, what is the lowest effort, highest impact thing that you can do for climate change? I say vote. And not only should you be voting yourself, you should be getting your patients registered to vote as well. Now, you can't, for reasons of not violating our rules in terms of being physicians at an academic center, you should never be telling people how to vote. Your job is to make sure that your patients are registered to vote. What we know from the data is that those who have actually suffered the most burden from pollution, from historic discrimination due to the pollution of fossil fuels are the least likely to be registered to vote in the first place. So the most important thing you can do, especially in 2024, if y'all are not familiar with VoteER, please check out VoteER, please get yourself a badge and start getting your patients registered to vote. We also at the consortium put out a candidate guide. So since we do a lot of get out the vote effort, and then we do a lot of effort to raise the profile for climate change during an election year. And so part of this is creating this candidate guide, encouraging people to go to town halls or to write to their decision makers to ask them what they're doing on climate change in a nonpartisan fashion. Both parties should be considering solutions to this problem. Second most important thing you can do, but this one requires more energy and more effort, is to join a group. If you're really concerned about climate change, going at it alone, it's hard and you're unlikely to get very far because this problem is big and it can feel discouraging pretty fast. And so I would say, I tried when 2016, 2017, I tried to kind of find my own spot or my own space and try to do work in different ways. And it wasn't until I found a group in 2019, I felt like my work really catapulted forward after that. Because what is that quote? Like, never doubt that a group of small people can make a difference. Indeed, it's the only thing that ever has. Like, I can't remember who said it, but it's true. And I think it's particularly true about whatever social issue you care about. So whatever advocacy you do it in a group. And these are just a couple of groups to mention in the Bay Area: Climate Health Now and Physicians for Social Responsibility Bay Area, where you can learn great skills and do things together. I learned how to write op-eds with my colleagues, do legislative visits, and how to march for change as well. Also on a policy level, our academic societies are hugely powerful. Decision makers listen to our academic societies. And so I've done a lot of my work through the American Academy of Pediatrics, and it has been amazing. So when I started in 2019, we had written a policy statement about it, but it certainly wasn't one of the Academy's priorities. But thanks to the group of pediatricians that I started working with, it is one of the top priorities for the American Academy of Pediatrics now. We've created the first board for certified materials for any specialty in the country on this. We've been able to make a lot of gains and change because we banded together as a group of advocates within our society for it. And then finally, I encourage you to join us. This year, we are the Medical Society Consortium on Climate and Health. We started as an organization of a handful of medical societies 7 years ago now. We are up to 50 medical societies that have joined us that represent 700,000 physicians around a shared banner on climate, health, and equity. We put on an annual meeting every year where we do educational sessions on climate and health. And then we do a lot of sessions particularly on advocacy and communications. And then the 3 days is capped by a visit to Capitol Hill, where we set up meetings with your decision makers. This year, understanding what's at stake, this isn't going to be our meeting. We are doing a coalition-based meeting with the Alliance of Nurses for a Healthy Environment, Healthcare Without Harm, Physicians for Social Responsibility, Medical Students for a Sustainable Future, and a number of other partners. Because I cannot overemphasize how important 2024 is to the future of humanity. That has been true for 2020 and 2016 as well, but we do not have a year to waste. So I encourage y'all to sign. We don't have our registration open quite yet, but we are going to make this a hybrid conference. So everything will be available virtually as well if you cannot join us in person. And I encourage you to join our community and check it out.
Thank you so much, Lisa. I just wanted to draw people's attention to a couple of links in the chat. So one was the article, the op-ed that you wrote for the New York Times on child health and wildfire smoke. And then I also put that in the chat, the link to the AAP Chapter 1, which I think is what you're referring to for the climate change task force. And also to give a shout out to Dr. Sonia Swenson, who is now one of the co-chairs of that task force and has worked closely with you, Lisa. She's also a graduate from the UCSF pediatric residency and was one of the pathway residents. So again, just it's really amazing. Like you said, what you can, a small group of people can really make a big difference. And then also Erica shared a link for the California Nurses for Environmental Health and Justice. I'll open up for questions, and right before I do, also just say that we do request evaluations and really appreciate getting your input. So I'll put that link into the chat as well. And feel free to come off mute, raise your hand, or put questions in the chat. I can start us off, Lisa, or sorry, Jean, did you have a question? Go ahead, Jean.
Yeah, Lisa, it seems like your group is primarily an advocacy group, but are there groups that are doing research in the Bay Area that you're aware of that we could get involved with?
Sure. Yeah, I would say because you're at UCSF, the very easy and wonderful one is the UC Center on Climate Health and Equity. So if you're not familiar, it's Ariane Tarani and Sherry Weiser run it. I would reach out to them and sort of get your pulse on, and if you go to their website, I think all the various faculty that are involved in that center are listed there. But you can probably, I think it might be more efficient to set up a time to talk to them about your research interests, and they can probably direct you to the right faculty member.
Thanks.
I've been trying to think about how to phrase this. I think Lisa has a question, and maybe it's in kind of how, like, your mental model as you're thinking about this, but we've spent some time talking about how global health is really local health, and what we're ultimately trying to do is decrease health disparities broadly. I think climate change is probably one of the best examples of how global and local are the same, where the things that we do in our neighborhood, in our county, in our country impact the health of people worldwide. Just curious, maybe again, it's more of a philosophical question. Like, how do you think about it as you're starting to tackle these issues? Are you thinking locally for, the community? Are you thinking statewide? Are you thinking, countrywide? Are you thinking globally? How do you kind of wrap your head around it?
That's funny. Over time, I realize I've always gravitated towards the systemic, and the reason why I bring this up is because a number of my colleagues, they love to work on a local level, and they're both super impactful. The question is, who are you, and where do you derive your energy? And where do you feel like you need, the other thing, part of why I became a physician, I moved away from being in environmental science, doing just full-time environmental science, to medicine, was that it was just really hard to work day in, day out in an office and feel like I was making an impact. And so I wanted something where it was service oriented, where I felt like I could really make an impact. And there's a reason why I'm a hospitalist, which is that, a baby comes out not breathing, I get them breathing. That feels great. It's like a problem that I can fix right away. And it's a nice balance for me that I do that. I can fix it right away. And boy, this is going to take me a really long time to fix kind of work. But I like having that balance in my life. So I think the question for everyone is, there are so many different ways to make an impact, and a lot, particularly for climate policy, I'll say local and state is really important, because often what happens federally is driven by models on the local and state level. And so if that's where your energy is, that is such a great place to apply your energy, both because you can have that immediate impact and because you can serve as a model for other places to copy.
I just want you to know I ride my bike as much as I can. Any other questions from the group? Comments? Okay. I don't know, Lisa, do you feel comfortable sharing your email in the chat? And if people want to follow up with you, they can.
Like I said, my real passion is advocacy. I've worked in Saving the Affordable Care Act and gun violence and children at the border. I'm passionate about all of it. And so if you ever have questions about how to link your career to advocacy, please feel free to reach out, because we just need more people ensuring that whatever work you're doing is affecting our policies and our systems for change. I mean, that's what inequities are, right? Like there's systemic and structural issues. And so we should always, in my mind, we don't have time to waste anymore. We should always be tying the work that we do to these larger structural issues.
Yeah, that's fantastic. Well, thank you very much. This is always one of my favorite talks, like I said, and both eye-opening and inspiring simultaneously. Thank you for your time today.
Thanks.